LASIK is a way of correcting refractive error. What we're doing here is using the laser to resculpt the cornea, and by doing so we can focus the light directly on the back of the eye. Usually with LASIK we can get rid of astigmatism, nearsightedness, and farsightedness. There are two steps involved in the LASIK process. The first step is the creation of a flap. After the flap is created, the flap is then lifted and the treatment is then placed on the stroma of the cornea. After this point, the flap is then returned to its original position.
Traditionally, the LASIK flap was created with a microkeratome. The microkeratome is a handheld device which has an ultra-precise blade. The blade is used to sculpt the cornea and create the flap. For the last several years, we've had another method of creating the corneal flap. A laser called an Intralase can create tiny bubbles in the cornea. These bubbles then coalesce and create a flap. The Intralase, because it uses laser technology, is both safer and more precise than the mechanical blade.
After the flap is lifted, the treatment is then applied to the cornea. And the treatment can come in two different forms, standard or custom. In standard treatment, what we do is we take your glasses prescription and we dial that into the laser. Custom treatment, however, is a little more accurate than standard treatment. Custom is based on a wave scan of your cornea, and this is kind of like taking a fingerprint of your eye and applying this to your cornea. An analogy for custom technology is the following. If you take 50 people that wear the same size 10 shoe, and you take that shoe off and look at their feet, you're looking at 50 different feet. By that same token, if you take 50 people that have the exact same eyeglasses prescription and you look at their eyes, you actually have 50 different eyes. Custom technology takes that into consideration, so you're actually getting a treatment that is custom made for you, where we take into consideration all the little individual differences between people, and that's the treatment that you get. As a result, the vision tends to be a little bit better and sharper.